What are the disadvantages of keyhole spine surgery or endoscopic spine surgery? When a patient comes for a keyhole spine surgery, he would have already known, or the surgeon would have already told him the advantages of keyhole spine surgery. But it's equally important that what are the disadvantages of keyhole spine surgery. A patient who is well aware of all the things related to surgery has better outcomes. So we as surgeon believe in educating the patient with both the advantages and the disadvantages and the complications of the procedure which the patient is trying to undergo. So in this session, let us speak about the disadvantages of keyhole spine surgery. The disadvantages of keyhole spine surgery are very less compared to the open spine surgery. But even then, as the patient attendant, it becomes your right, and also it becomes your duty to understand the disadvantages before accepting or before going for the surgery. So let us elaborate the disadvantages of the keyhole spine surgery. We will go from the most common disadvantage to the most rare disadvantages are the complications. Okay, first one. As I have told you in my prior interviews, a single surgery doesn't fit everyone. So of all the diseases in the spine, there are few diseases which cannot be treated by keyhole spine surgery. The keyhole spine surgery for the neck, or we call the cervical spine, is being developed. It is not commonly done. There are very few surgeons who would do it, and the surgeries are not so popular right now. But when you come for the lumbar spine or the low back, the keyhole spine surgeries have become very common. The many surgeons have started gaining expertise, and there are at least 3 to 4 surgeons at each metropolitan city who have gained expertise and who are doing it on a regular basis. They have gained expertise of more than 10 years right now. So when it comes to the low back or the lumbar spine, at least 85% of the diseases can be treated by keyhole spine surgery. Whereas it comes to the cervical spine, 85% of the cases will require an open surgery or a microscopic spine surgery than a keyhole spine surgery. All this is as per my experience. So every surgery cannot be done by keyhole spine surgeries. Some surgeries are better done by keyhole, some surgeries are better done by open spine surgery. The lumbar spine, which is very commonly dealt with keyhole spine, in 85% of the cases they can be done by keyhole spine surgery, and 15% of the cases still require an open spine surgery. Second one, what are the complications? The keyhole spine surgery is done in a special kind of anesthesia which is known as local anesthesia or epidural analgesia. This anesthesia is far safer compared to general anesthesia which is required for open spine surgery. So keyhole spine surgery can be done for patients with very sick patients, like patients with heart disease, patients with kidney failure, patients with asthma, patients with uncontrolled diabetes, patients with uncontrolled hypertension, and many other diseases. But at the same time, when this surgery is done under local anesthesia, spinal analgesia, the patient is awake. Even though he doesn't feel the pain or he feels minimal pain, some of the patients become anxious. So what we do, we have a trial run. A day before anesthesia, we take the patient into the theatre. We teach them what is going to happen, so that on the day of surgery they are not anxious much. Third one, then can keyhole spine surgery cause nerve damage? The amount of nerve damage and the incidence of nerve damage which can occur in open spine surgeries is higher compared to the keyhole spine surgery. And why? One thing is, in keyhole spine surgery, the patient is conscious. So if my instrument touches a normal nerve root, immediately the patient will have a small shock like sensation, and he will alert the surgeon that my instrument is touching the nerve root or the neural structure. So I bring my instrument away from the nerve root so that I will not damage the nerve. Whereas in open spine surgery, the patient is under general anesthesia. So until the surgery is over, sometimes we will not be able to make out whether the nerve has been damaged or not. Whereas in keyhole spine surgery, on the table, during the surgery, I will understand whether I am touching the nerve so that I will be able to avoid the nerve damage. So the incidence of neural damage or fresh neural deficit after a keyhole spine surgery is less than 1%. Is less than 1%. And because the keyhole spine surgery done under brilliant illumination and high magnification, which shows the normal nerve in very clearly, crystal clearly, the chances of nerve damage will be very, very low. Third complication is infection, which can be seen in any surgery, but compared to open spine surgery, the chances of infection are also very, very low in keyhole spine surgery. The instruments which you use in keyhole spine surgery are very, very minute. Sometimes it happens that during surgery the instrument breaks and is retained within the disc space. In majority of the cases, you will be able to remove that broken instrument, but sometimes if you are not able to remove the broken instrument through the keyhole, then we may have to convert it into open surgery to remove the broken piece. But this is definitely very, very rare. Apart from this, rare complication which can be seen in keyhole spine surgery are they are actually very rare, but failure. Sometimes you may have to convert the keyhole spine surgery into open spine surgery. Sometimes there can be injury to a layer around the nerve root, which can cause leakage of CSF. Sometimes you may require an open surgery at a delayed rate. Sometimes you may have a recurrence, and the recurrence rate is around 5 to 6%. So these are some of the complications which can be seen in rare patients. So before you go for a keyhole spine surgery, do ask for the complications or the failure rate. Although they are less compared to open spine surgery, you are supposed to know them. Thank you.